What is renal angioplasty and stenting? Renal angioplasty is a procedure of opening a blockage in the arteries of the kidneys. It is done to improve blood flow in the kidney area. Blockages made of fatty cholesterol and fibrous plaque, usually at the entrance of the kidneys, can cause a decrease in blood flow and cause what is known as renal artery stenosis. Stenosis can cause high blood pressure, shortness of breath, retention of fluids, ankle swelling, or headaches. If the decrease in blood flow is severe, it can cause serious complications, such as kidney failure. In this procedure, a very small tube, called a catheter, is inserted through a small, less than 5 mm incision in your groin or arm. Through this catheter, a small amount of dye is injected to identify if you have any blockages. Once a blockage is identified, another small catheter with a tiny balloon at its tip is placed across the blockage and then inflated, pushing the blockage away into the artery walls. A stent is then expanded and left in your artery to keep the bloodstream flowing well. What happens before the procedure? You're not supposed to eat anything after midnight on the day of the procedure. You should take your morning medications with only a little water on the day of the procedure, unless specifically requested by your doctor not to do so. If you have diabetes and use insulin, you may need to decrease the dose of your insulin on the morning of the procedure. If you have an allergy to the dye used for the procedure, your doctor might prescribe some medications to be taken a few days before and after the procedure. If you have any kidney problems, you should take plenty of water for 24 to 48 hours prior to the procedure. On the day of the procedure, you will register yourself at the admissions office. Following this, you will be directed to the catheterization lab, where you will be placed in a recovery area and meet your nurses and physicians. They will perform a brief assessment and examination and go over the risks, benefits, and alternatives of the procedure with you, then have you sign a consent form. You will then be escorted to the catheterization laboratory. What happens during the procedure? You will be given medication to relax you and make you sleep, but most of the time you can be roused so that the medical team can ask questions and give instructions. You are also given blood-thinning medication during the procedure. You will lie flat on your back on a catheterization table. After preparing the area in the groin or arm with antiseptic solution, you will be covered with a sterile drape. A small amount of numbing medication is injected into the skin. In the majority of patients, this is the only part of the procedure that is slightly uncomfortable. A tiny incision, smaller than 5 mm, will be made in the groin or arm, and a small tube that is less than 3 mm is placed in the artery. A small catheter over a soft wire is sent through the tube and is guided through the blood vessels to the arteries of the affected area of the kidneys. The physician will then take pictures of these arteries using a contrast dye and X-ray. This will allow the physician to see exactly where the blockage is. Once a blockage is identified, another very fine metal wire is used to cross the blockage. Over this wire, a small catheter with a balloon at its tip is advanced and placed across the blockage. This balloon is then inflated and pushes the plaque into the walls of the artery and increases the arterial lumen, or inside space. A stent over the top of a second balloon is then moved in. The stent expands and locks into place as the balloon is inflated. It will help keep the walls of your artery open. The stent is the only thing that stays in your body. Everything else, including all wires, balloons, and catheters, are then removed. The small tube first placed in your groin or wrist is either removed at the same time or secured to the skin to be removed later that day. What happens after the procedure? You will be observed for 6 to 24 hours for any complications. You should be able to walk within a few hours after the removal of the tubes from the groin or wrist. The average hospital stay is 1 day or less. Some patients stay overnight for observation, but many go home the same day of the procedure. You may be put on blood-thinning medications after the procedure. It is very important to use these regularly as instructed. Otherwise, a blood clot may form at the site of the recently opened blockage. Avoid any strenuous activity with the leg or arm where the tube was inserted for 2 to 3 days. If you notice any bleeding, call the nurse or doctor immediately.